Good afternoon or good evening. First, I'd like to start off with a land acknowledgement. As we gather, we are reminded that Guelph is situated on the treaty land that is steeped in rich Indigenous history that has been home to a variety of peoples over the millennia. As settlers, we are grateful for this opportunity to meet here, and we thank all of the generations of the people who have taken care of this land for thousands of years. We acknowledge the historic Mississaugas of the Credit, the First Nation people who were the treaty signatories of the territory on which we are meeting here today. Treaty number 3, known as the Treaty Between the Lakes 1792, remains today. Today, this area has become home to many First Nations, Métis, and Inuit people whom we share this land, their achievements, and their contributions on this shared community. As a community, we have the responsibility to the stewardship of this land on which we live and work. We are reminded of the Dish in One Spoon Indigenous law that ensures there will be enough substance for all of Earth's creatures. We offer this acknowledgement as an act of reconciliation between the Indigenous and non-Indigenous peoples of Canada. So good evening. My name is Tracy Curtis. We welcome you here today. Believe it or not, this is our 11th Finding Your COVID Balance seminar. This started in the very beginning of COVID. So I am the chair of Bracelet of Hope, a proud Rotarian, a proud Guelph Rotarian, and also a mother of 2 boys and a financial advisor, business owner in town. So we're all touched on this on so many levels. And this started as a Bracelet of Hope fundraiser because we have mobile health units in Lesotho and foster homes and foster children that we're responsible for. And when COVID first happened, we were terrified we lost all of our ability to fundraise. So if you have it in your means, you can visit it to Bracelet of Hope website and take a look. If you're able to donate, we would be very grateful. We have launched a mobile health unit that is actually now testing people for COVID in the remote areas of Africa, which never would have happened if we didn't launch our mobile health unit. So thank you for listening to that. I'd also like to share with you tonight that this is Mental Health Week. You may notice my sweatshirt. How are you really? This was the CMHA fundraiser that happened in this winter. And I wear this sweatshirt with pride. And I ask my children, I ask my friends, I ask my colleagues, like, how are you really? So we are taking the time to really listen and hear how we are all managing during this difficult time. So this year, more than ever, we want to stress the importance during this particular seminar to take care of your both physical and your mental health. So as these webinars, that's what we're wanting to do. So everyone here is volunteering their time. We've all worked hard, been on Zooms all day, and we're here really just to help you get through to the next day, seminar, next month, and we're going to get through this together. So if you love these webinars and would like to support the CMHA, Waterloo and Wellington, we would ask you to please consider signing up for this year's virtual Shoppers Drug Mart Women's Run. This year's run is, of course, virtual. So if you can walk or run anywhere between July the 4th and July the 11th, and all the money that's raised will go to women's mental health. So not only will this walk and run be a boost to your own mental health because it gets us out running, and we know that we need the sunlight and we need good exercise, but it will also support over 3,000 people locally on the waiting list for ongoing services. So you can create a team, sign up with your friends, and you can do something virtually together and have a bit of fun. So all participants will get a t-shirt. And also, this is a great part, is that you get a $150 Shoppers Drug Mart bag. So check it out. I am going to introduce our moderator for tonight. Marva Wisdom is a dear friend and a fellow Rotarian. Anne-Marie is also a Rotarian, so we're proud to be fellow Rotarians together at the Rotary Club of Guelph. Marva is a keynote speaker, a facilitator, a researcher, and she helps our clients and communities embrace diversity and demand inclusion and build cultures of belonging. So Marva is just been an incredible community leader of ending systemic racism, and we're so grateful, Marva. We asked Marva 11 seminars ago, would she be interested in moderating this very important discussion? And here we are in the month of May. It's May, right? I've lost track of what month we're even in. So thank you, Marva. I'd like all the ladies to join in. I'm going to leave you, and then I'll see everybody at the end. And thank you again. Thanks again, Marva.
Thank you, my dear friend, Tracy. And yes, my fellow Rotarian, thank you for the work that you do in the community. And thank you for what you are doing in leading Bracelet of Hope and for the people of Lesotho. Really very much appreciated. As Tracy said, we're grateful to have the opportunity to speak with you. And yes, it was 11 sessions ago that I said yes, that Helen Fishburn and Marie Zajdlik said yes. Tonight, you may be joining us either on the Zoom webinar link or via our Facebook Live broadcast. We are ready to receive questions from either platform. So please feel free to type your questions into the Q&A section of either Zoom or Facebook, and we will do our best to answer all of your questions tonight. If we can't get to your question live, we will endeavor to answer your questions at our next webinar. We are recording this webinar and it will be posted on CMHA's Waterloo Wellington webpage and on CMHA, the Bracelet of Hope, and Anne-Marie's Facebook pages. We may get to it right after the webinar is over, but give us a little bit of time. Things get a little bit busy, and as volunteers, sometimes it takes a little bit for us to get it there, but we will get it as soon as possible, certainly within the next 48 hours or so. And so I am just really thrilled that each month we have Anne-Marie and we have Helen, two panelists that continue in a recurring role to answer your questions about mental and physical implications of COVID-19 pandemic. And of course, you've come to know Anne-Marie Zajdlik, a primary care physician in Guelph, providing comfort and guidance to thousands during the pandemic. Anne-Marie's become quite the Facebook sensation with her daily posts of encouragement and sound scientific knowledge about COVID-19 and other health issues. And of course, Helen Fishburn is the CEO of the Canadian Mental Health Association of Waterloo, Wellington. And Helen also brings her wisdom to this conversation, and CMHA Waterloo Wellington has been a partner in this. Helen is a lifelong advocate for increased awareness of mental health issues, and she has dedicated her career to advancing the design of an improved mental health system. We are so very happy to have them both here as panelists tonight. And what we've done, ordinarily we have a guest. I think there was only one time when we did both, just Helen and Anne-Marie. And this time around, it's the two amazing women, and we're going to ask you later on to sort of tune in to June 1st and the weeks after. And so tonight we are going to be looking to answer your questions. As I mentioned earlier, we want to get the conversation going. We know we have folks who are calling in from all over, even as far away as Alberta and who knows where else. We want to answer as many questions as possible, but we know we won't get to every one of them. We'll do our best to get to as many of them as possible. And so I'm going to ask Helen and Anne-Marie, maybe Helen first, in light of this week being Mental Health Week, if she could provide some opening comments to our viewership, and then over to Anne-Marie after Helen is done.
Great, thank you, Marva. Always great to be with you and Anne-Marie and our community, actually, every Tuesday evening, the first of the month. So For us, there is no better time than right now to have Mental Health Week. We're still in a really tough part of the third wave. There's, you know, a lot of indicators we're going in the right direction, but we're still not out of the woods. We can't let our guard down, but we also know that keeping our guard up is exhausting. Not seeing our family, our friends, going out to movies, out to eat, playing golf, going to church, all the things that we love to do and actually are really good for us. It's a long list of losses that we've had through these restrictions. For those of you that have ever had a mental health issue as well, you'll know that prior to the pandemic, it was really difficult to name that and to come out of the shadows. You'll also know that it feels different now. The pandemic has been the great equalizer for us. We're being seen and we're being heard. If the third wave has had any silver lining, it's that it's really helped to continue to stomp out stigma. So for this week, we're going to focus on embracing our vulnerability and our brokenness. Yes, even the negative emotions we're going to embrace, because that's what makes us human. We're having the good days and the not so good days. So tonight we're going to continue to find our balance physically and mentally and celebrate everything that makes us human.
Thank you, Helen. Emery?
Yeah, I had an interesting experience at work today. There was a real shift in how people feel, I think, based on NACI's recommendations about the AstraZeneca vaccine yesterday. And we're going to talk about that. People are, this past week, so much more despondent, hopeless, irritable, you know, not being certain about the future, wanting to give up. That's the sense that I'm giving, or that I'm getting. And I just want people to realize that despite all the news and all the information that's being thrown at you, we've got this. Like, take a look at the good numbers, and be of good cheer if you can. It's getting harder and harder to do. At our last webinar 2 weeks ago, there were 10 million people vaccinated with their first dose in Canada. Now there are 16 million. We've vaccinated 6 million people in the last 2 weeks alone. There are 34% of Canadians now have the first dose, 40% in Toronto, 40% in Guelph, Wellington, Dufferin. And guess what? The vaccines are just starting to arrive by the millions now. We were able to vaccinate 16 million people during a time of vaccine scarcity. So what do you think is going to happen when all these vaccines pour in? We're gonna get everyone vaccinated with their first dose well into June, and then start going after. So we'll talk more about that, but that's what I look to. And I wish I could grab everybody, however many thousands of people are listening, and just sort of scoop you up and carry you along and remind you how well we're doing. Focus on that, stay the course. We are doing amazingly well.
Thank you, Anne-Marie. And you brought up NACI, and I'm not crazy about acronyms, and I asked you what that meant earlier. So I'm gonna say what it means, the National Advisory Committee on Immigration. You and I feel the same way about acronyms. We shared that earlier. And so one of the first questions I'm gonna ask you is from Joanne that says, and perhaps you and Helen can discuss this, because not only we're talking about vaccine and vaccine hesitancy, but we're also talking about the mental health component of feeling that you don't have control. Of when something happens and you feel, oh my God, the other shoe has dropped. I was feeling really good and very excited, and suddenly I'm anxious and I'm feeling some anxiety. So here's the question, and if you can both just have a conversation about this as related to what you referred to, Anne-Marie. The person says, I'm reeling from the headline in Guelph today about the National Advisory Committee on Immunizations chair recommending not getting AstraZeneca. I am vaccinated with the AstraZeneca vaccine and did this to be responsible. Messages like these are so confusing. I would love some reassuring words from the panels.
I'll start. This is me pulling my hair out. Because this was not helpful. NACI's recommendations are not the recommendations of the medical community or the scientific community. It was poorly timed, and I want to put it into perspective. Their recommendations were taken out of context of the fact that we are in the middle of a pandemic with huge numbers of new cases still every day. And in that context, the AstraZeneca vaccine is an excellent vaccine, and you should get it if it's offered to you. The leader of NACI did not say you should not get an AstraZeneca vaccine. She said that the messenger RNA vaccines are the preferred vaccines. If we were in New Zealand and there were only 1 or 2 new cases a day, then yes, maybe the messenger RNA vaccines would be preferred, and you could actually say that publicly. But the risk with the AstraZeneca vaccine, remember, of these rare blood clots is extremely rare. 1 in 250,000 people may develop this rare clot. But if you get COVID, and we're all at high risk of getting COVID right now because it's so transmissible and it's out there, you have a 25% chance of having a serious deadly clot. With that perspective and in that context, the AstraZeneca vaccine is an excellent choice, and you should get it if it's offered to you. If you're offered a messenger RNA vaccine, you get that vaccine. And I am so confident, I will tell you, get this. If the second dose that's offered to you is an AstraZeneca vaccine, get that vaccine, because the sooner we are all fully vaccinated, the sooner our lives go back to normal.
Thanks, Anne-Marie. And Helen, how does Joanne work through the anxiety that she's feeling with this news and others who are listening?
Yeah, it's a tough space to be in right now, right? So we're all learning as we go. There is no playbook, there is no rule book. We have seen politicians make missteps and things, open up that shouldn't have been open up. And we see this misstep with NACI, frankly. And of course, it feeds on people's fear. We're all concerned, we're all worried, we're all wanting to do the right thing. And we have, many of us don't have control over a lot of those things which are happening in the community as well. So Anne-Marie's words are very, very important. Stay the course, continue to do the things that we know keep us safe and keep us protected. There's continue to follow the data. There is some really good indicators right now that everything that we're doing is working. Things are getting better. It's not overnight, it's not fast, but we will get there. And in the meantime, continue to do the things that help you manage the things that are outside of your control, which of course always feeds our anxiety. So those are simple things like CBT techniques. So changing your thinking, changing your behavior, continuing to use your support networks, continuing to get exercise, continuing to do your very best to sleep well and eat well. Those are extra essential right now, especially as we get through the next couple of weeks. Thanks, Helen. Can you say what CBT means, CBT technique? CBT is best practice treatment for anxiety and depression. Okay. It is cognitive behavioral therapy. So it's changing your thinking, which then changes your behavior. Wonderful, thank you for that. There's a tough topic that it's very hard for families to talk about, Helen. And as we look at Mental Health Week, it is folks that die by suicide. And with the vulnerability that individuals are feeling now, I think about those who I know who are extroverts, who get their fuel from being able to go out. And if you had any presentation of any sort of mental health illness, it makes it that much more difficult. Can you speak to that, Helen, and how people might be feeling now, or those that might be going through or know someone who are going through this kinds of discussion? And I know Anne-Marie, as a physician, the challenge becomes that sometimes you're presented with that as well. Maybe you can both comment on that and what you see. Sure, maybe I can speak just generally to suicide to begin with, and then Anne-Marie, feel free to add a piece just relating to anybody you're aware of. So suicide is a very painful topic. And of course, during Mental Health Week, we are really invited to name it, not numb it. That's the theme that we're having this week. So it is really important to talk about negative emotions or dark spaces that people get into. The first thing that's important to understand about suicide is it's never one thing. There's never a single issue or event that leads a person to die by suicide. Suicide is not a mental health disorder. It's actually a complex behavior. And there are many, many factors that contribute to somebody who goes into a very dark spot. And there's what I would call a bit of a perfect storm in a lot of those situations, because there's a number of factors, whether they're biological in terms of the person's inherited them, there's some situational context, and there's other factors outside of that person's control, which all leads them into that really dark spot. And everyone's story is very unique when it comes to suicide. So a couple of things to think about. Suicide is not about wanting to die. It's actually about struggling to live. It's really about pain. When life gets too painful, this intense sadness can lead to a belief that your life has no meaning and there's no hope. People get into that dark spot and that's all they see. Someone who's thinking of suicide might be frightened, they might be confused, they're ashamed of having those feelings, and they don't want to burden other people with that. It makes it very hard to reach out for help when they get to that dark spot. So we really want to encourage people to pay attention to people that you know and love and are close to, and to look for signs that are a struggle for them. Things like talking about wanting to die. People actually say things that they're looking for a way to end their life, or they start giving away their possessions. They're feeling hopeless. And they use those words, which are sometimes invitations for people to reach out to them. Sometimes there's reckless behavior, uncontrolled anger, withdrawal from families and friends, changes in sleep patterns, and certainly sudden mood changes as well. There's a very simple ways that you can have conversations with people. You can start certainly by just telling them that you're concerned and identifying some of the things that you see in them that you're worried about. Ask them openly and directly, are you thinking of ending your life? And I know that's a really hard thing to say out loud, but sometimes naming that for the person can actually be a relief for them. Because they've been carrying this, they've been so burdened by it, and actually naming it can help them and open up that channel for them to talk about. And then of course, the last thing we encourage you to do is really just listen with compassion for that source of pain that they're dealing with. And that really sets the stage for moving forward. It invites them into that conversation so that you know that you're willing to walk that road with them and be a support.
Mm-hmm. And it sounds like part of it, this might sound simplistic in my brain. I'm thinking just being empathetic under all circumstances with whomever you meet, because you never know where they are.
That's right.
In life. And I think that's one of the things earlier on in COVID that I noticed. Our empathetic side as a society, as a community, seemed to have increased, and that has allowed us to talk about things that we ordinarily may not talk about. The unfortunate thing with lockdown, you don't see people to have those conversations as readily as you would. And that's why when Anne-Marie says that we're getting out of this, where you both have said, we're getting out of it, just hang in there, just hang in there. And to name it, don't numb it, is something that we all need to remember. And of course, you have a hashtag, Helen, that said, get real with how you feel. That's and right. It's not only them getting real with how they feel, but also those around you getting real with how they feel and with how you feel. And
I think that's an important part, Marva, a very important part, because sometimes when you get a person gets into that dark spot and that's all they see, they convince themselves that they're a burden to everyone else, and that actually dying by suicide would be a relief for people. That's actually in their mindset. So you reaching in and talking to that person and helping them to name that, helping them to understand how much they mean to you, and that you can work with them and support them to get help, is literally a lifeline for that person.
Thank you, Helen. And Anne-Marie, as a physician, as a family doctor, you are presented with all kinds of mental and physical ailments that you see. How do you deal with that in your practice? What are some comments that you can make towards
I think it's important to listen to what Helen has told us, and also to remember that your primary care provider is trained in assessing someone's suicide risk and in assisting people who have suicidal feelings. And we are dealing with that every day now. Every day, there are people who are coming in feeling that desperate. And reaching out for help is extremely important. When you do that, you'll find that there's a whole team of people behind that primary care provider in most situations who can also help you. And medications often provide play a vital role in the treatment of depression with suicidal thoughts. So definitely reach out to your primary care provider as well.
Thank you, Anne-Marie. Thank you for that. We have Deborah from Alberta. Deborah says, I live in Alberta. I am so distraught with the selflessness of Albertans who refuse to adhere to public health measures, and a premier who refuses to listen to medical advice and lead. I'm quoting Deborah now. Mm-hmm. She says, I am worried sick about my sons out working. I will leave Alberta, but until I can go, I have no way out. Oh, I have followed the rules since the beginning, watching others who have not. I go to bed anxious. Can you comment for Deborah who's listening? Thank you, Deborah.
I'm so sorry, Deborah. I'm so sorry that you're in this situation. What I think this whole pandemic has revealed to us is that you cannot mix politics with leading a pandemic and leading a population out of a pandemic. Politicians, by nature, have competing influences that will change their decision-making away from what is best to make the population healthy again, and what is best for political interests. So I totally agree with you. It is a terrible situation, and I hope we put some kind of act in place before there's another pandemic that says politicians stand down. This is your expert committee, and you defer to that expert committee, and no longer try to mix politics with a pandemic. There are still vaccines happening in Alberta. Stay as safe as you can, and I'm sure that reason will prevail in the next couple of weeks in that province.
Hear, hear. I hear people cheering at the other end from what you said. Leave it to the experts, right? We will remember that. And Michelle asked, how effective are the vaccines against the new variants, even the ones in India? Are certain vaccines better than others against variants?
So the main variant in Canada and in the province of Ontario is the B117 variant, which is the UK variant. And we know that all of the vaccines are effective against the UK variant. Less information about the South African variant, the Brazil variant, the India variant. So there seems to be partial protection from the vaccine against these other variants, and studies are ongoing. Especially after the second vaccine, there will be partial protection. Remember that these vaccines are more effective than any vaccines humankind has ever made. The flu shot is 60% effective, and we call it a good vaccine. If vaccine effectiveness is getting to 80 or 90%, which is where these vaccines we presently have are against the B117 variant and the original COVID virus, then decreased effectiveness might take the effectiveness down to 60%, which is still excellent and still will prevent death, hospitalizations, and serious illness. Get vaccinated. 2 vaccines, the first one offered to you.
That's great. Great answer. You heard it from Dr. Zajdlik. You heard it right here. Helen, Scott has said that he's been very cautious since the start of the pandemic. He's always worn 3 masks at all times. He doesn't leave the house unless he has to. He hasn't seen his children or grandchildren. He cries himself to sleep, and he's constantly on edge. He's starting to think that he's protected himself from COVID, but he's given himself a mental health condition. Is it possible that he's been too cautious, he says? Should I have let my guard down? Scott, thank you for sharing that.
Yeah, I was just going to say that, Marva. Thanks so much, Scott, for naming this. I mean, our webinar is actually called Finding the Balance, because that's exactly what we're all struggling to do. And you've named that really well. This is obviously, it's still really critically important that we follow the public health guidelines and provincial orders. That is going to keep us safe, and it's going to flatten the curve. So we absolutely have to do that. But I also acknowledge and recognize that doing that makes it extremely challenging to take care of our mental health. There is a way to do both, but sometimes, you know, landing on that sweet spot is really hard. Interesting, there's a new study that's just been published out of the UK. They're a few months ahead of us on the COVID pathway. And they're seeing a rise of COVID anxiety syndrome. So in essence, after 15 months of lockdown, people are actually now afraid to go out. Some of the behaviors that initially were used to protect people and kind of were a rational response to danger are now becoming kind of maladaptive ways of coping. We've really internalized that fear, and people don't want to go out. They're avoiding public events. They're not using public transportation. They're not wanting to touch people. It's really become quite an interesting dynamic. 1 in 5 people in the UK are experiencing this. So people get locked into these patterns of behavior. And I think that's something that's really important for us to recognize in your question, Scott, is, you know, we have to find that balance. We can't stay locked into, like, it's not natural to follow these public health guidelines forever. We need to do it now while still being able to do everything we can to support each other and support ourselves in terms of staying socially connected. But certainly pay attention to that as we move forward, because if people are not able to start reintegrating back into community in our society as those restrictions ease up, then that's something that we really need to pay attention to. Otherwise, people will be entrenched there and then really struggling moving forward with that post-COVID anxiety.
And we have a COVID anxiety poll right now. And I must say, we have some wizard behind the scenes. Our director or technical director is Allison, and Allison is just behind the scene, as is Tanya, doing our communications and sort of troubleshooting for us. So we thank them both for the work that they're doing behind the scenes to really make things work well. So here's a poll. We're going to ask you, here's a poll, here are the results. The question was, do you think you might be prone to feelings of COVID-related anxiety when lockdown measures start to ease? And that goes to what Helen just shared. The answer is 66% of you think that you'll be prone to COVID-19 anxiety, and 34% has said no. So full 2/3. And so it goes back to in looking at mental health implications after COVID is done. What is that going to look like, and the pressures on the system now? So I'm hoping, although Anne-Marie, we said politicians need to just stay in your lane and focus on what you need to do, but we also want them to listen.
Stay in your lane.
Right? We want them to listen really carefully to this and look at that poll. Imagine that 66%. So we're going to need lots of help there, and Helen can sort of pipe in on that a little bit later as we go forward. Another quick question, and this is for you, Anne-Marie. Are there any recommendations around how many weeks into your pregnancy you should be before you get the COVID vaccine? And also, have there been any reported birth defects in infants from mothers who received the vaccine that you know of?
Day 1 of your pregnancy, get vaccinated. Because pregnancy almost immediately suppresses a woman's immune system so that she does not react to the fetus as a foreign object. That decrease in the capacity of your immune system dramatically increases the risk of getting COVID-19 and getting serious consequences of COVID-19. Last week, there were 15 pregnant women in ICUs across the province who were intubated. They do well, so it seems like they're recovering and getting off the tube. There haven't been any deaths, but oh man, that's disastrous. And so it is a high priority now to immunize all pregnant women at any stage of pregnancy. And the vaccines are proving to be safe in pregnancy. This is real world data coming from millions of people who have already been vaccinated. What was the second part of that question, Marva?
The second part was, let me just look at the question here, having to do with reported birth defects, possibly. Mm-hmm.
Yes, no reported birth defects. And really the biology of the vaccines makes it not possible to cause birth defects or troubles with your placenta or trouble with future fertility. The vaccines don't mess with your DNA, and birth defects are often caused by problems with the person's DNA. So it's not possible for vaccines to cause birth defects, not these vaccines to cause birth defects.
That's good to know. That's great. Great answer. This is another question about AstraZeneca, but it's a different kind of question. Someone talked about understanding the risk of VITT. I'm not sure what that means. Is it 1 in 100,000 with the AstraZeneca vaccine? But what are the symptoms one should be aware of? And is this blood clot condition treatable if caught in time? Yeah. And how do we empower AstraZeneca vaccine recipients to be aware of symptoms? How do we put our minds at ease? For you, Anne-Marie.
These are great questions. I almost need to have a personal conversation, or could go on for 10 minutes about this. So the risk of the rare clots called VITT, that's vaccine-induced thrombolytic thrombocytopenia, or something like that, used to be called VIPIT. It's a different type of clot that is very rare. I think I read somewhere that the risk of the clot without the vaccines present, it represents 1 in a million of all the clots that occur naturally in the population. So it's extremely rare. The risk with the AstraZeneca vaccine is between 1 in 100,000, but more likely 1 in 200,000, 250,000. So we have to put that into perspective. The countries that have used a lot of the vaccine are seeing about a risk of about 1 in 250,000 to 1 in a million. Extremely rare risk of getting the clot. The clot can occur anywhere in the body, and there's also a rare venous clot that can occur in the brain. Clots in the lower leg will cause swelling in one leg, pain and swelling in one leg, and some redness often in that leg. So if you have had your J&J vaccine or your AstraZeneca vaccine, or even your messenger RNA vaccine, because there is a tiny risk with that vaccine too, if you have redness or swelling in one leg, you need to present to the emergency room. Any shortness of breath that kind of comes on suddenly could mean that you have a clot in the lungs. And so shortness of breath, you should present to the emergency room. If it presents between 4 days and 14 days after the AstraZeneca vaccine. And then the clot that occurs in the brain, which is even more rare, can cause headache, dizziness, blurred vision, fever, nausea, and confusion. So if you have a headache between day 4 and day 14, and it's outrageous, along with those other symptoms, that headache needs to be seen in the emergency room. Yes, these clots are treatable, and we're developing greater skill as time goes on at treating these vaccines. There still is a 40% mortality rate in someone who has the venous clot in the brain. The deep vein thrombosis in the lower leg and the pulmonary emboli have a much lower mortality rate if they're present early enough and get treatment. But that central venous clot in the brain has a 40% mortality, is treatable.
Thank you. Thank you, Anne-Marie. That's wonderful. Lots of information on AstraZeneca. And so I'm hoping that folks that are listening, they feel really good and really empowered, and feel that there is some confidence if they get the vaccine, or even if they have gotten that already. So with that, we want to do another poll, because we want to find out about vaccine hesitancy. Are you at all hesitant about the type of vaccine you are getting? And this is a yes, no, or not sure. So you have a few seconds for that. And the poll is up. And while you're responding to the poll, which is going to be down in just a moment, a question for Helen, and this is specifically from Katie for you, Helen. I am a 15-year-old grade 10 student in Waterloo. I miss my friends, my teachers, regular school. What are some things I can do to make sure I keep myself mentally healthy? I worry that this will never end. Oh, that's so
yeah, that's very sad. But Katie, thanks for, again, putting that right out there. I think a lot of people are feeling the way you are as well. I mean, after 14 months, this has been an absolutely brutal ride for us in many ways. I would say, especially people your age, Katie, who, you know, being at home with your family is not where you would be spending most of your time. You know, people your age are out in the community, you're with your friends, you're with your networks, you're at school. You know, the family home might feel like a little bit of a prison after this amount of time for youth, and that's understandable. But I think, you know, you've taken an important step just asking the question, and we're, again, because of Mental Health Week, really encouraging people just to name it, just to say how they feel, just to put it out there rather than suppress it or numb it. Your emotions are completely normal and healthy right now. I don't know many people that don't feel the way you do. Like, everyone is struggling with the same thoughts, for sure. And certainly don't be afraid of those feelings, because under the circumstances, they are completely normal. In terms of like, is this ever going to get better? The data is showing us that in fact it is. And that's something that you can trust. It shows us progress. It's scientific. We're definitely going in the right direction, even though it's not completely resolved yet. We are moving in the right direction. And what we see a lot with people with their fears is, although fears are very valid right now, we want people to focus on the facts and not let their fears drive them. Following fears can certainly lead us down that dark path that I had talked about earlier, where people just get locked into a really, really bad spot. So follow the facts, continue to use your support system. I'm sure you have been doing that already through this pandemic. Remember that even though we have to stay physically distant, we absolutely have to stay socially connected. And that's a really important piece. So continue to use your networks. The other thing I always say to youth is find a project. Pick something outside of yourself, outside of your family, outside of your school that you can do, whether that's writing letters to people in long-term care homes, making masks, doing something online. Pick a project and do something and channel your energy there. We know youth are incredibly creative, innovative, and you know, we don't have long. I really hope we don't have long until we're in a completely different space. So do something creative to channel your energy there and actually feel good about using your time.
That's great. Thank you, Helen. And for Anne-Marie, do you know, here's a poll before we get to you, Anne-Marie. The poll says, are you at all resistant, right, about the type of vaccine? And the response is this: 26% says, yes, I'm resistant. 67% says no. That is wonderful. I know, Emery, you'd love to see 75 and above. 67% is heading in the right direction, and 8% not sure. Emery, can you comment on that, both you and Helen, on the poll results? 26% yes, 67% no, and 8% not sure.
Yes, I think being vaccine hesitant after yesterday's announcement from NACI is completely reasonable. And I think we need time to process that information and to look for the advice that's coming from other health experts, and more importantly, the majority of health experts who will tell you that there is not a preferential vaccine right now at a time when COVID presents such a high risk. They're all good vaccines. We should still get the first vaccine that's offered to us, again, because the risk of COVID and its dangerous consequences is so extremely high right now. And all these vaccines are safe and effective, except the extremely rare risk of clots with the AstraZeneca vaccine.
Okay, that's great. And another question for you, just follow up, Emery. Do you know when those people who are at high risk and have registered some time ago with Wellington Dufferin Guelph Health Unit will receive their vaccinations? And they're thanking you for the webinars and your Facebook posts as well.
I missed the first part of that question because I'm sorry, my cell phone went off. Can you ask that again?
Okay. It could have been an urgent call.
Right.
Do you know when those people who are at high risk and have registered some time ago with Wellington Dufferin Guelph Health Unit will receive their vaccinations?
So you are in phase 2. There's a difference. There's 3 levels to phase 2: high risk, risk, and low risk. Okay, high risk, normal risk, and low risk, something like that. If you're high risk, you will probably be getting your vaccine in the next 2 weeks. If you're lower risk, you're going to get it in the next 2 to 4 weeks. The vaccines are coming at a very rapid rate, huge numbers of vaccines. So don't be surprised if in the next 2 weeks, many people are called in to be vaccinated, and that most of us have received the first vaccine by mid-June. Phase 1, 2, and 3, mid-June.
Great. And what about travel? Once this is done, what is the medical recommendation on international travel? What this person is sharing, that they heard that international student will not be permitted to travel. And is that enough?
Yeah, that's again a political decision about closing borders and decrease or limiting our ability to travel. I don't think the medical profession can make recommendations except that those are good recommendations not to travel at this time. I think it will be safe for us to travel not only when we've had 2 vaccines, but when we focus on the countries that are resource poor and need help getting the vaccines as well. And I do think there are murmurings now that there will be some sort of vaccine passport, whether that goes against our civil liberties or not. There may not be a way to get around traveling without having a vaccine passport.
They're certainly looking at that at the UK and the European countries right now. So it gives us a little bit of a template to look at. And I would also add, Marva, that it's going to be dependent on where you're traveling to as well, given what kind of state that country is in.
And no, thank you for that. That makes a lot of sense. And as we know, maybe a few months ago, it seemed like a place like India, if you were going to travel there, they were doing really well, and suddenly not anymore. And so some of this is also day by day, right? Or month by month. Yeah. A 16-year-old wanted to know, or someone wanted to know if their 16-year-old, if it's safe for them to get the vaccine. Do we know that yet? Do we have data on that yet?
So a 16-year-old getting the vaccine, it is now recommended that in phase 3, we vaccinate everyone 16 and above. And in some of the hotspots in the province, they are actively vaccinating people that are 16 and above. And there are also some places in the province that are vaccinating high-risk folks, children that are between the ages of 12 and 16. These vaccines are proving to be safe in the younger age groups. And by mid-July, we will probably have the final results of these studies that will tell us they can be used in all age groups, and then start rolling the vaccine out to younger people.
Okay, thank you. And can you give some insights into what it may look like after people have had both shots of the vaccine? The reproductivity rate has decreased to less than 1. I'm not sure what that means, and what will life look like? Maybe one of you can explain when the person says the reproductivity rate. I'm not thinking that it has to do with pregnancy.
Right. So the reproductive rate is a measure of transmission. It tells us how many people one person can infect. So how many people who have the COVID-19 virus, how many people can they infect? If you put barriers up to transmission, like vaccines and public health restrictions, then it is much less likely that a person, will transmit. It will take more for a person to transmit to other people. So when the R value goes to less than 1, a person with COVID is transmitting to less than 1 person, which is fabulous, because if you stay there, the virus will eventually die out.
Okay.
I would also add, Marva, that we're learning from countries that are ahead of us in this journey. And, in the States, for example, the CDC has released quite a guideline for how people who have received 2 doses of the vaccination, what they can do and what they, what they can't do still. And so I think our country is very much watching and learning from other countries who are a little bit farther ahead in this journey. And we're in a good spot to be able to do that, right? We're going to be able to learn what is working and what isn't working for those countries and be able to then adjust our approach correcttly.
That's a great point. That's a great point, Thank you, Helen, for that. And I have to share some greetings from the traditional, this is Jen Pugsley, greetings from the traditional territory of the Saugeen Ojibwe Nation. So I just wanted to share, that's wonderful. Thank you so much for that. A question for you here, Helen. Someone said that I saw in the news that Alberta is letting 12-year-old kids with high-risk conditions have Pfizer, even though it's not ready for healthy kids. Will my high-risk 15-month-old be able to get Pfizer anytime soon? Now, I know that Emery responded to that question in some ways, talking about 16-year-olds and up that are getting the vaccine. So I guess with Claudia, with this response, have you heard anything regarding 12-year-old kids, Helen?
They're doing a study in Canada right now for kids between the ages of 12 and 15 and looking at the impact. And they have a sample, a test case that they're working through right now. I believe they're hoping to have that information ready by the fall. And then of course, if the results are positive and there are no harmful side effects, then they would use the school system as a way to vaccinate kids between the ages, well, any child over age 12, they would use the school system to do mass vaccinations.
Wonderful, thank you. And that answers the question as well when folks start talking about in September, do we anticipate that kids will be vaccinated for school? So I think you responded to that. Another question for you, Helen. We have 2 little ones. This person has said ages 3 and 5 months. I'm thinking 3 years and 5 months, not 3 and 5 months. As we look into the summer and beyond, when most are vaccinated, fingers crossed, how would you suggest navigating small social gatherings with children present? When will we know when it's safe for grandparents to hold their children? We want to be as safe as possible. Again, the mental health component is just pressing hard on all of us.
It is. And honestly, those days can't come soon enough, right? We're all really wanting to reunite with our families and having grandparents hug their grandkids again. I know we have certainly missed that in my family as well. It's been heartbreaking not to have that this year. So science will tell us. Science will tell us when it's safe for us to do that. The guidelines will be revised, will be adapted. It's going to be a slow and careful and thoughtful rollout of the, releasing the restrictions. It's not going to be all one day you're restricted and the next day you can do anything you want. It's going to be a very slow and careful return to life as we knew it. And I think there will be a very careful eye on what happens with the reproductive rate that Anne-Marie has just described, with the COVID numbers, with the new variants, like all of that factors into how we reopen our community and, start to embrace each other again, literally. So it's going to be slow, it's going to be careful, and it's going to be based on science.
Thank you for that. Really appreciate it. Another question, Emery, and this ties into Helen responded to a question earlier, and this is getting more specific about the WDG region. Waterloo region is vaccinating 12 to 15-year-olds in congregate care and with high-risk health conditions with informed consent and a physician's referral. Do you know if there's a chance that Wellington, Dufferin, Guelph region can do this as well?
I'm not sure, but I can ask and get back to you. Okay. I think Nicola can answer that question. I have not heard that information yet for Guelph, Wellington, Dufferin.
Great.
I haven't either. No.
Yeah. Shelley Chalmers has written, and this again is about school. And as you can imagine, so many parents, well, you already know, so many parents now have gone with the kids in school, and now kids are back and parents are working from home, children are working from home. And so that mental health piece, Helen, is just way up there for so many families. Shelley says, I am having a hard time understanding why we heard today that school boards will be required to plan for virtual learning for the entire 2021-2022 school year. The children in my life are devastated by their loss of in-person learning. If we're doing so well and the vaccines are pouring in and we are nearing the end of this nightmare, why are we even thinking about anything other than in-person learning against all expert advice about what is best for our children and their mental health and learning? This announcement has increased my anxiety and feelings of hopelessness. Sounds like there's a political piece to this as well, but we'll leave it to you, Helen, to respond.
Yeah, to be honest, I hadn't heard that. And I'm not totally surprised. I mean, so the school year next year, we certainly hope that everyone's going to be back in school in person. I think we'll need to likely phase that in. And it's going to be, again, one of those slow, gradual, careful, thoughtful approaches where we're watching all the numbers so carefully. So that is likely what the planning is about. There's going to be some bridging between having kids in class and having kids online, and how to best plan for that. And, you know, sometimes you plan for the worst, right? And hope for the best as well. Hopefully we can get all of our kids, all of our teachers back into class in person as soon as possible. But I think in the meantime, it's really about that careful planning of what could be.
Mm-hmm. Thank you. Thank you for that.
I understand though how much anxiety and anger parents would have just hearing that, because frankly, working from home and having your kids homeschooled, it's an absolute nightmare to manage both of that over an extended period of time. It's exhausting, it's overwhelming. And it's like parents have to be professional jugglers.
Mm-hmm.
So it's absolutely draining. So I can imagine, parents hearing that and just feeling so overwhelmed by that information. But everybody wants their kids back in school. The politicians, the school boards, parents, that's what we're absolutely working towards.
Although I might add, there are one or two unique folks that are excited to have their kids doing virtual classes because the children weren't striving as well in school. But you're right, the vast majority,
absolutely,
the normalcy of being in school. And I know we've answered a number of, I think the responses to the AstraZeneca question was really, really thorough. We've had a ton of questions about AstraZeneca. I'm just going to ask this one, is another side of it that may not have been covered. If someone received the vaccine, are there any increased chances for them to have a blood clot after the second vaccine if they do not have one after the first? And this is regarding AstraZeneca.
That's a good question. I'm not sure the answer is known, but that was something I was about to read about. Biologically, it makes sense that if you did not react to the first one, you will not react to the second. We think that the rare clot is caused by triggering a person's immune system to attack a protein on their platelets. And that's what causes them to have the reaction. Again, it's rare. But if you've not had the reaction after the first, you don't have an immune system that's going after your platelets.
Thank you. Great. And is it possible to have our antibodies checked after our second dose to see if we need a third dose sooner rather than later? This is one of the questions that folks are asking. Yep. The person has an autoimmune condition.
Yep. It is possible to have your antibodies test, but right now it's not covered by any government to do that. I think guidelines will be put into place once everyone's vaccinated about whether or not the antibody tests will be available to everyone and who should get the antibody test. But as of now, it's not available, covered by the government.
Okay, thank you. And I'm going to give you three, the third one in a row, okay. And then back to Helen. If we start focusing on second doses in July, does that not mean that there will be some people that are at risk of waiting more than 4 months for their second dose?
Yes, thank you for asking that question. There's a lot of people have asked this question. So the mix and match studies, they're very interesting and ongoing, where they're mixing and matching vaccines, so that you may get the Pfizer vaccine first, but then get the Moderna vaccine second. You may get the AstraZeneca vaccine first, but then get a messenger RNA vaccine second. And in those studies, they're showing that there might be an improved immune response if you mix vaccines. So it is likely that we will be mixing vaccines. If we can mix vaccines, it is also very likely that the interval between vaccines will be reduced from 16 weeks to somewhere less than 16 weeks. So a combination of two things will likely decrease that interval: the ability to mix and match vaccines, and the number of vaccines that are flowing into the country. There's interesting research to say that if you mix and match vaccines, get two different vaccines, you may have a better immune response and better protection than if you use the same vaccine for both dosages. Really interesting stuff. These are all moving targets, but I do believe you're going to get your second vaccine before 16 weeks.
Great, thank you for that. That's a big question. A lot of people are concerned of the long wait. Helen, this person is thanking you, of course, for how you addressed dying by suicide and spoke about how you can help others. Their question is, what about those who are left wondering after someone has ended their life?
So on average, if someone dies by suicide, we see the immediate impact from about 10 to 15 people who are really significantly suffering as of a loss, after a loss of someone that they loved by suicide. It's absolutely heartbreaking on so many levels, and people are constantly going back to think about what if, what could have been, and they're haunted by those feelings. So it is so essential for those people to be supported. They're actually more at risk themselves, survivors of suicide. So that is something that is absolutely critical. We actually have a new program that we are just piloting in the north part of our area in Wellington County, called Support After Suicide. For those of you that have lived in this area, you may remember a few years ago that we really struggled with a really significant increase in deaths by suicide in Wellington County over a couple of year period. And so with partnership with Wellington County and with Wellington OPP, CMHA, we developed a new program called Support After Suicide. And we hired a team to work with people that were bereaved and lost someone to suicide. That has been a very successful program because, again, those people are at risk because of the grief and really complicated grief that comes along with a death. So we want to expand that program. We want to get that program into Guelph and into Waterloo region as well, where our catchment area is. And we're certainly looking at how we can do that this year. But in the meantime, of course, anything that you need relating to support in the aftermath of suicide, please connect with us at Here 24/7. We can connect you to the available supports and services across our area. We have some amazing work done by the suicide prevention councils, who do a lot of work with people that have been bereaved by suicide as well. We have counseling agencies that we connect with in this work. We also work with some of our partners who specialize in grief and loss. So there is a whole network. And if you can call us at Here 24/7, we can connect you and make sure that you get the right service and support. But please do that, because it is so essential to attend to that loss and that grief and have a way to name it and really address it.
Myself off mute. We're down to the last few questions. Thank you for circling back with that. That is so important. And again, reminding people that this is Mental Health Week, and maybe pay closer attention than you have been before about the people around you, especially during this pandemic. Anne-Marie, can you please remind people that you still need to follow the guidelines despite being fully vaccinated? I think I'm doing that now. Please, the person says, my whole family was COVID positive with the UK variant, despite my husband being fully vaccinated and myself having the first dose. So the answer is yes, please. So maybe you can do a quick plead and then lead into talking about the India double variant. If you could do both, and then I'm back to Helen with the last few questions.
So the public health restrictions need to remain in place at least until everyone has had 2 vaccines and until we see the number of new cases decline, and they have to decline significantly. Remember that these new variants transmit very easily. So if you do not yet have herd immunity, the virus will continue to spread. Mm-hmm. The danger in allowing the virus to spread before there is herd immunity, and public health will decide when it's safe for us to let the public health restrictions go. They will base that on the science. The danger is that as long as you let this virus replicate, divide, transmit to other people, it will mutate. And the mutations, we know, the variants of concern are very dangerous. So keep those masks on, keep your distance, don't gather, and get vaccinated ×2 so that we beat the virus and it can no longer replicate and develop variants of concern. I don't think very much is yet known about the Indian variant. It is not when they say double mutation, it makes it sound so scary, but it is very similar in terms of the mutations that other viruses have, the other variants of concern. It is much more transmissible. Is it more transmissible than the UK variant or the South African variant or the Brazil variant? It probably is, just based on what we're seeing happening in India. Will it respond to vaccines? Most likely, but the vaccines may be less effective. Remember that even if your vaccine is less effective at decreasing the risk of you picking up COVID-19, they are still dramatically effective at reducing the risk of serious illness, hospitalization, and death.
Thank you. Thank you, Anne-Marie, for that. Helen, can you recommend any articles or books that will help initiate conversation with a family member who has blocked you from their life because of their belief in conspiracy theories? And I've heard of a few.
Really good question. And we're seeing definitely a rise of the conspiracy theories, anti-maskers, just again with the third wave and how challenging it's been, and some of the missteps, frankly, politically, and with some of the information out there that floats out there that people think is fact, but it actually isn't. So all of that creates the breeding ground for conspiracy theories to really survive and thrive. I believe we have some information on our Here for Help .ca website. So here, the number 4 help.ca, there's some information there. I will make sure I'll talk with our team to make sure there's some information there about how to support folks that are really struggling to believe the facts. And we also have some information there as well about how to work with people's fears around vaccine hesitancy as well. On the Mental Health Week website as well, which CMHA National puts up, it's mentalhealthweek.ca. There are all kinds of great articles, videos, and toolkits relating to mental health, which just helps people with their fears, their anxieties, working through those feelings. That would be also a great spot to look as well.
Thank you, Helen. And about 2 more questions. Marceligo Bruce has said hi, asked this at the start, but worth repeating, and thanks everybody for their entire team for all their time and concern. This was asked, but I don't think this was responded to. He says, recently I've heard that there have been a number of cases of myocarditis linked to the second Pfizer shot based on Israel's report. And he's wondering if there have been any of these cases linked to Moderna that we know of. Seems like there have been some kind of rare but serious side effect from all but Moderna. So he's wondering whether this is true. Have you heard anything in that regard, Anne-Marie or Helen?
No links to the Moderna vaccine as far as I know, but remember, the Moderna vaccine has not been given to as many people. The Pfizer vaccine has been given to millions and millions more people than the Moderna, and that's just because the supply and distribution of Moderna, it has been more difficult coming from a very small company. Moderna is actually a small company, Pfizer's Goliath. So once more people are vaccinated with Moderna, we may see that signal and that uptick in cases of cardiomyopathy.
Thank you. Thank you so much. And Helen, sometimes I think people may be afraid to reach out because they're unsure of what to expect. Can you please share a bit of what people will experience when they call the Here 24/7 line, or when they interact for the first time with CMHA? But in addition to that, maybe when you're answering that interaction, someone who says that they're feeling overwhelmed with working from home, helping with kids, that's what we've been talking about, learning at home, parenting in general, says it's too much, I'm definitely languishing. I thought I would bring that back. Any tips on how to feel better? So in calling the Here 24/7, that will be helpful, but any tips in addition to what to expect on the Here 24/7 line?
So awesome question. So Here 24/7, so all of our staff right now are virtual, so they're working from home. And anyone that calls into Here 24/7, the very first question is really going to be, first of all, thank you for calling. Thank you for reaching out. And second of all, where are you at right now in your life? What's the reason for you needing to reach out? And really just working with the person, having a conversation to unpack that. We have about half of the calls people who are concerned about themselves. The other half people are concerned about someone else. And there are different pathways that we would walk down depending on whether you're calling for yourself or someone else. We always try to understand what is at the heart of the concern and to really then match that to the appropriate care or services that is provided. Of course, we always talk with folks that are imminently at risk as well. If they have thoughts of suicide, for example, we would go out and see those people immediately. With other folks that are not in crisis, we would just unpack what their concerns are, help them really sort out what problem are we trying to solve, and then try to match them. It's very much an individual conversation, and we really try to be present and listen, because that's we know how hard it is for people to call. Marva, you're going to need to remind me because I have full brain syndrome. What was the second part of that question?
Parents at home with kids feeling anxious, being a parent, just languishing and trying to feel better. Any tips? And that will be our final. We're down to only a couple of minutes for closing. So Helen, if you could end with your wrapping up, especially with Mental Health Week.
Sure, and really that question ties beautifully into my closing, which is really about embracing all of the feelings that we have right now. That is part of what we do in Mental Health Week. It should be part of what we do every week, but certainly after a 14-month pandemic, it is absolutely vital to do. If you, right now, 8 out of 10 Canadians are really struggling with their loneliness, fear, worry, they're feeling overwhelmed. So if you're feeling that way, you are absolutely not alone. 79% of people say that they're really overwhelmed with negative emotions. So if you think about your car, if you have that much negative emotion, your engine light would be on. So pay attention to your emotions. They're a warning sign for us. That's an engine light that tells us that something isn't right or isn't feeling right in our bodies. And take that somewhere that you can get it attended to, whether you're talking to your family doctor about that, whether you're talking to Here 24/7, where you're joining us for one of our webinars. We've got webinars every single day this week to celebrate Mental Health Week. Tomorrow night, we've got one, for example, on men's mental health, which is being facilitated by 2 of our amazing leaders, male leaders, and an OPP officer. We're inviting men to come and into that session and just share and talk and work through their feelings. We have webinars every day. Come, be open, share. What we know is that if you can name those emotions, the negative ones especially, you will be lighter. and you won't be carrying the heaviness of that. So name it, don't numb it, get real with how you feel. We're here to help you and support you, as are many people across our community. So please, this is a great time to reach out.
Okay, wonderful, thank you. And Anne-Marie, do you last minute comment before I close?
I'm just going to reiterate what I said at the beginning. Too much news is not necessarily good for folks. If you are watching the news too often, only bad news gets picked up. That's what's sensationalized. But there is such good news out there, and we are going to see a totally, as Nicola said last week, within 4 to 6 weeks, we're going to see a totally different landscape. It will be hard for us to move into that landscape initially, but that's okay. We will get there soon enough. And the key is that more than 75% of us, 75% or more, get 2 doses of vaccines to bring about herd immunity.
Thank you, Anne-Marie. Well, this hour and 15 minutes just went by so very, very quickly. Thank you, everyone, that you've tuned in and you have listened. We appreciate that you have tuned in. We hope that we have been helpful. We really appreciate Anne-Marie and Helen joining us tonight. My goodness, the information that you've shared in this short space of time, I know that it was helpful to me, and I know that it was helpful to many who are listening. And we thank those who have shared their appreciation. We haven't had a chance to read all of it, but we know that we appreciate hearing from you about how this might be helping you. And a reminder that we are accepting donations to both Bracelet of Hope and Hope House. And of course, a reminder of the Women's Run this weekend for Mental Health and Mental Health Week. And the links will be on Facebook, and certainly the link for Bracelet of Hope is also on Facebook. Do join us on June 1st when we bring you the next webinar, and we will continue to work on bringing you the first Tuesday of each month. And we love doing this. We appreciate you. We appreciate our community and beyond. And have a wonderful night. Stay safe, and remember not to numb it. Helen, what's the term again? I think the term is
name it, don't numb it.
Numb it.
You got it.
Thank you so much. Have a great night, everyone. Thank you, Allison, and thank you, Tracy, and thank you, Tanya. Bye-bye. Cassie, you're so funny.